this video, we will be going over rotator cuff testing used in the differential diagnosis of thoracic outlet syndrome. The first tests we will look at are full and empty can. These tests are used to assess the supraspinatus muscle and tendon. The patient can be seated or standing. Their arm should be elevated to 90 degrees in the scapular plane with elbow extended and full external rotation. The therapist stabilizes the shoulder while applying a downward directed force to the arm. The patient tries to resist the motion. In empty can, the arm will be elevated to the same motion but will be full internal rotation instead of external rotation. These tests are considered positive if the patient experiences pain or weakness with the resistance. The sensitivity is 0.886 and the specificity is 0.588. Hornblower sign is the next test we will be looking at. This test for the teres minor tear, the patient can be seated or standing. The therapist will place the patient's arm to 90 degrees in the scapular plane and flex the elbow to 90 degrees. They will then ask the patient to externally rotate against their resistance. This test is considered positive if the patient is unable to perform external rotation. The sensitivity is 1.0 and the specificity is 0.93. Next, we will be going over internal rotation lag sign. This tests for the subscapularis tendon. The patient should be seated. Their arm will be brought into maximal internal rotation behind their back. The therapist will control the patient's arm at the elbow and wrist or hand, which is passively brought into 20 degrees of extension, taking the forearm and hand away from the back. The patient will be instructed to actively maintain this position as the examiner releases the wrist. The test is considered positive when there is a lag seen. An obvious drop will indicate a large or massive tear. A smaller lag will reveal a partial tear. The sensitivity is 1.0. The specificity is 0.84. Next, we will look at the external rotation lag sign. This tests for supraspinatus and infraspinatus tears. Patient should be seated. The elbow is going to passively be brought into flexion of 90 degrees while the shoulder is held at 20 degrees of elevation in the scapular plane in a position of near maximum external rotation. This is considered negative if a patient can hold the position. A positive test is if the patient cannot hold the position and their arm may spring back anteriorly. For infraspinatus tears, the sensitivity is 0.97 and the specificity is 0.93. For teres minor tears, sensitivity is 1.0 and the specificity is 0.93. Lastly, we will look at the drop arm test. This test assesses for supraspinatus tears. The patient should be seated. The therapist will passively abduct the arm to 90 degrees and full external rotation while supporting the arm at the elbow. The therapist will then release the elbow and ask the patient to slowly lower the arm back to neutral. This test is negative if the patient is able to control the lowering of the arm slowly and without their symptoms occurring. It is positive if there is a sudden dropping of the arm or weakness in maintaining the arm position. There may also be pain present while lowering the arm, suggesting a full thickness tear of the supraspinatus. The sensitivity is 0.73 and the specificity is 0.77.